Welcome to the Arizona Early Intervention Program's presentation on the changes in AZIP eligibility determination. These changes are the result of new federal requirements for the Individuals with Disabilities Education Act Part C. This webinar is one in a series created to help Arizona's early intervention community understand and implement the new requirement effective July 1st, 2012. New regulations that affect policies and procedures are indicated in red font. In viewing this PowerPoint, you will need to advance the slides as you are ready. Established conditions now include disorders reflecting disturbance of the development of the nervous system, such as any of the cephalic disorders. Congenital infections, including cytomegalovirus or rubella. Disorders secondary to exposure to toxic substances, including fetal alcohol syndrome. There are two methods of determining eligibility for AZIP. The first is a review of records that document either an established condition or a 50% delay in one area of development. The second is an evaluation to determine developmental delay using an appropriate evaluation instrument. The policies define initial evaluation as the child's evaluation to determine his or her initial eligibility. It requires the administration of an evaluation instrument for all children when conducting an evaluation to determine if a child is AZIP eligible based on 50% delay in one or more areas of development. Informed clinical opinion may be used as an independent basis to establish a child's eligibility, even when other instruments do not establish eligibility. It prohibits informed clinical opinion from being used to determine a child ineligible if test scores show eligibility. It requires evaluation in the language normally used by the child if determined developmentally appropriate. Let's walk through the process. Upon referral, the service coordinator reviews referral information to determine if the child has records that would document either an established condition or a 50% delay in one area of development. If records are available at the time of the referral, the service coordinator works with the appropriate team members to determine eligibility and schedules the initial visit. The service coordinator documents the eligibility decision on the AZIP data form. If the child does not appear to have records to establish eligibility, the service coordinator schedules an initial visit to conduct a screening. If records may be available to establish eligibility, but were not included with the referral information, the service coordinator talks with the family to determine if the records are highly likely to verify eligibility and are available from the family. If not available from the family and not likely to verify eligibility, the service coordinator begins the screening process. If not available from the family, but highly likely to verify eligibility, the service coordinator gets consent to obtain records and proceeds to child and family assessment. In this scenario, the date of eligibility is based on the date records were reviewed. If there is no indication of available records to establish eligibility, the service coordinator contacts the parents regarding their concerns and verifies that there are no records available. They then proceed with the screening processes. Review of medical or other records for eligibility can be completed by the following team members. If records include documentation of an established condition, one core team member, not to include the service coordinator, may review the record and determine eligibility. If records include an evaluation conducted by a therapist, the team member of the same discipline reviews the evaluation to determine if there is sufficient and current information to establish a 50% delay and determine eligibility. All records are kept in the child's file, and information is documented on the AZIP data form. For children for whom an evaluation is needed based on screening results or parent request, the service coordinator must obtain prior written notice consent for evaluation. An evaluation instrument must be used. Two people from different disciplines, not to include the service coordinator, must conduct the evaluation. The evaluation is in the language normally used by the child if determined developmentally appropriate to do so. The multidisciplinary team may use informed clinical opinion to establish a child's eligibility if the instrument used does not establish a 50% delay in development, but other information supports the decision. In interpreting evaluation information, the team may not use informed clinical opinion to determine a child ineligible if test scores show a 50% delay in development. Evaluation information is documented on the AZIP report form, not on IFSP pages. The purpose of evaluation data is to determine a child eligible or not eligible for AZIP. An evaluation instrument must be used with all children needing an evaluation. Teams must document instances when an appropriate instrument is not available, such as in the case of extremely young infants, or when administration of an instrument is attempted but not successfully completed. Teams would document this information in the summary of informed clinical opinion. In addition, teams would document the information that was used and an explanation of how that information led to the eligibility decision obtained. The scoring table could then be marked as either not applicable or partially completed as deemed appropriate by the multidisciplinary team. The team summarizes test information on this table. If a broad spectrum tool and a discipline-specific tool are both used at the evaluation, the discipline-specific tool results would be reported as they would be recognized as the most valid and reliable. For example, if a DAISY and a PLS are used in the evaluation, the PLS results would be recorded and the DAISY communication section would not need to be administered or recorded. A 50% delay is roughly equivalent to a standard score of 70 or less and/or the second percentile rank. Standardized scores are recognized as more statistically sound than age equivalents. Thank you for viewing this PowerPoint. You may submit questions to allazip2@azdes.gov. For more information about AZIP, you may visit their website at www.azdes.gov/AZIP.